Hope everything is fine with you. Whatever time you are, I greet you. So, here in Nigeria, it's evening time. This is about, I think, after 3. So, it's still good evening or good afternoon. So, I want to talk about premature rupture of membranes. Premature rupture of membrane during pregnancy. Hello. How are you guys doing? Premature rupture of membrane with PROM. If you want, in a short form, is PROM. PROM. Premature rupture of membranes. That is when the amniotic sac breaks before labor begins. If it happens before 37 weeks of pregnancy, that's premature rupture of membranes. Normally, most women, they rupture when the labor starts, or immediately they start seeing the sign of labor. But if it ruptures without labor sign, it could lead to so many other things. The woman have to immediately report herself to the hospital for her to be well taken care of. And I always say something, that as a pregnant woman, if you notice anything that is off, anything that is not normal, please go and see your midwife or your doctor for things to be put right. Because if the membrane ruptures prematurely, it could place the woman at the risk of the woman and her baby at the risk of infection and premature birth. So treatment involves a balance between continuing the pregnancy to reduce prematurity risk and expediting delivery to lower infection, often including corticosteroid and antibiotics. When this happen, most time when the membrane rupture prematurely and the pregnancy is still not up to 37 weeks, what most doctors will do, or midwife will do, is that they will admit the woman in the hospital, place her on antibiotics, and allow the pregnancy to continue because of infection. Because that membrane is like the cushion that the baby, the baby floats inside the amniotic sac. God has made it in a way that the baby is protected. That's why when all these our old people says that if you have sex during pregnancy, that the sperm can affect the baby. No, there's no way the sperm can get to where the baby is, because God makes everything perfect. The baby is inside that sac like this, and it's inside the uterus. And even the walls of the uterus are well prepared, thick muscles to protect the baby. But when these membranes now ruptures, the baby can get infection through the mother's private part. So it's always good to be at alert. If you see anything that is not right, please go and visit your midwife. And even when you see this water gushing out of you, you need to apply a very clean underwear and put pad, and check the consistency, the color, and how it's gushing out. But the most important thing that you have to do when your membrane rupture suddenly is for you to go to the hospital immediately. I've seen some video that as soon as the membrane ruptures, the baby follows, So you have to be very careful and very observant in this. Thank you, Michael Willie. How are you doing? Thank you. Good evening. How are you doing? Where are you watching from? Michael Willie. Thank you for coming to my live stream on YouTube. So what is this premature rupture of membrane? Stay curious, stay informed by Winner Jr. You are welcome. Thank you for coming. So premature rupture of membrane is that, just like I've explained, the amniotic sac which holds the fluid around the baby. If it's ruptured before the labor start, that is premature rupture of membrane. Okay, thank you. You are welcome. So what are the causes of this premature rupture of membrane during pregnancy? Infection, inflammation of the membranes can weaken them and then lead to rupture. If the membranes is infected, or there is infection, it can make it. Okay, you are from Nigeria. Oh, thank you. God bless you. That your name looks foreign, Michael Willie. That was why I asked you that. Where are you from? Thank you for coming. God bless you. So infection and inflammation can weaken the membrane, and this can lead to rupture of the membrane prematurely. Then weakened membranes, intrinsic weakness in the membrane tissue, possibly due to inflammation or nutritional factors, can also make the membrane to be weakened and ruptured. Then mechanical factors, conditions that increase pressure or strain on the membrane can also lead to this membrane rupturing, like multiple pregnancies, and excessive amniotic fluid that we call polyhydramnios. If you see a woman with polyhydramnios, the tummy, when she's pregnant, the tummy will be very big. You'll be wondering that how many children dey inside this belly. We call that polyhydramnios because the amniotic fluid is in excess. And the other day I made a video that when your doctor asks you to go for scan and the results, you now come back with the result under amniotic fluid, I wrote AF. That day I was telling the pregnant women that when you go for scan, you should always have learn some wordings there, so that you won't just be holding the results. You don't even know anything that is written. You can't interpret anything. So that day I explained some of the terms they use on the scanning result. So that day I was talking about AF, that is amniotic fluid, and I said that the doctor can write adequate or inadequate. If it's adequate, that means the amniotic fluid is okay for the baby to be floating. There are cases that it may not be adequate. It may have been draining, and in some other cases it may be over. We call it polyhydramnios. I've seen a case where a woman delivered with that polyhydramnios. I was shocked myself because the fluid that came out of her was always filling up a bucket, and this can also have effect on the baby. So as midwives, we see so many things in the labor room that we can't just say. So multiple pregnancies, either twins, either triplets, either quadruplets, can lead to pressure on the membrane, and it can make it to tear, and it will now rupture and start leaking on the woman's leg. So what are the symptoms of this premature rupture of membrane? The woman will notice a gush of fluid or a steady trickle of fluid from her vagina. She will just, maybe she's standing, she will just notice that water is coming out from her private part. Some of them will think it's even urine. And if she's sitting, by the time she will get up, she will see that her clothes is already weak. Suni Babu from India. Thank you. Good evening. I don't know the time you are in India. What's the time in India now? We are in the afternoon here in Nigeria, West Africa. We are in the afternoon. It's just after 3. I know India is far from Nigeria, so I don't know your time zone. You are welcome, Suni Babu. So as I was saying, the woman will feel a gush of water coming through her vagina, and this will make her to know. Some of them may be, especially the first-time pregnant mother, she may be scared that, am I peeing on my body? What is happening to me? But no, it's not peeing, because there's no way you will be feeling to pee, you will not know. When your bladder is full, there will be a message sent to your brain, and you feel that you want to urinate, and you go to the toilet and urinate. But this one, there's no any sign. You just have, I've seen some videos even on the internet of a premature rupture of membrane. Some of them, they are in occasions, and they will just see that the thing just rupture. Some of them in their homes, maybe in the kitchen, she'll just see the water breaks, and she'll be shocked that, oh my God, what is happening to me? As soon as you see that kind of a thing, please go to the hospital on time. So what are the treatments that can be done on this premature rupture of membrane? Well, the doctors confirm the diagnosis through methods like examining the cervix and performing tests on a sample of the vaginal fluid to detect that it is really amniotic fluid. The doctor will do VE, and what that VE signifies, the doctor is trying to see, when he does the vaginal examination, is for him to see maybe the patient is already in labor. Maybe the woman is already in labor, because some contraction may be mild and she may be dilating. She may not know. But when the V is done, yes, the doctor will know. But if the pregnancy is still under 37 weeks, that is premature delivery. Some of the part of the membrane may still be remaining. So he can still place her on antibiotics and corticosteroids, to prevent infection, and admit her to have a complete bed rest. Sometimes it works, the pregnancy will continue to grow, but if it does not work, she can deliver. The baby will be taken to the nursery to be put in the what do we call it now, incubator, for the baby to stay there for some weeks to complete the weeks, and the baby's lungs will be well developed before they will be discharged. Then the management approach to this case is that it depends on the gestational age, just like I said. If it's at term, after that is before you can say the pregnancy is term, it must have entered 38 to 40 weeks. That's what we believe in the hospital, that the pregnancy is term. Some even go as far up to 40 weeks before they start having sign of contraction to deliver. But if the pregnancy is term, immediate delivery of the baby is usually recommended. If it's above 37 weeks and the doctor check the cervix and see that the cervix has started dilating, there's no cause for alarm, and the fetal heart is okay. The baby is not in distress. I think the next thing they will do is either to do induction or to wait for the contraction to increase, and the woman will deliver vaginally, and everything will be fine. But if it's preterm, before 37 weeks, the management will aim to balance the risk of prematurity against the risk of infection. And this may include antenatal corticosteroid, just like I said, medication given to help mature the baby's lungs. The fear in prematurity most time is the baby's lungs, because the baby's lungs, they are not yet matured, and any small thing, they can get pneumonia, they can get respiratory infection, and this could be fatal. So in the hospital, they are always very careful, to see that this baby's lungs is well mature. Then by placing the woman on that corticosteroid, this will help the baby's lungs to get matured. Then antibiotics to treat or prevent infections in the mother and the baby. Yes, the baby is inside the mother, so any infection will also get to the baby. That's why we always say that whatever happens to the woman, because the woman is just like the incubator, she's like a cooler that the baby is developing inside her. So whatever happens to her, even when she's sad, the baby will feel it. When she's happy, the baby will kick very well. So prevention of this infection is very important, because it will affect both the mother and the baby. Then there must be close monitoring. Signs of infection, the pregnancy and the baby will be well monitored to prevent infection. And if there's sign of labor, there's nothing you can do. The labor is already, the cervix is already dilating. There's no stress about that. You just have to allow it to come like that. But be prepared for the baby, so that the baby will be well taken care of, and the baby can. So most time they survive even at 37 weeks. My people, 7 months prematurity is better than 8 months. That most time the 7 months baby survives even more than the one that is 8 months. I don't know the logic behind it. I don't know the scientific rationale behind that, but that's the general belief here, and I don't know whether it's true. Then if there's fetal distress, because of that, just like I told you, that amniotic, the membrane is the one protecting the baby from injury or anything, and now the thing is leaking. So the baby could be in fetal distress. By listening to the fetal heart or using sonicard in the labor room, if there's a sign of fetal distress, delivery, either emergency CS could be done to save the life of the baby. Then the expectant management. In some cases, the pregnancy may be continued for a short period under close supervision. If there is no cervical dilatation and the contraction is not much, so that could be treated for some time, but under a very strict monitoring, of the woman and the baby inside, so they can allow the pregnancy to get to term. So what I want you to know as a pregnant woman is that, don't panic when you are seeing this water coming out from you. Stay calm. Just note the time the thing starts, note the color and the amount of fluid, so that when you get to the hospital, you'll be able to give them, the detail of what you have been going through, of how it started. This will help the midwife to know how to ask, because she too and the other health workers, the doctors, they will have to put heads together to know the next thing to do. And just like I said before, that as soon as you see the water coming out from you, please go to the hospital immediately, so your midwife, your doctor can check you and your baby. One thing I know is that what is it that matters? What matters is that that baby is well protected. That baby is still alive. That baby is not under any fetal distress. If it's matured, it may be emergency CS. But one thing I also want you to remember as a mama is that never insert anything into your vagina when you are having this rupture of membrane. No, to prevent infection. Don't try to check how the fluid is coming. No, 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 no. Please stay calm and seek medical help immediately. It's very important. I always say that anything as a pregnant woman that you see that it's not normal, because you are the one carrying this baby. You are the one that water is dripping from you. And you know that you have been carrying this pregnancy maybe for 7 months, for 8 months. Nobody will carry a pregnancy and want to lose that baby. Just like women, nobody will get married. She's enjoying that marriage. Everything is fine. She now wants divorce. It's not possible. It's only stress and wahala that will make a woman to say, I'm tired of this marriage. I don't want to continue. My mental health is being affected. I just want to rest. But when everything is fine, no woman will say that. So you that are carrying the child, you know where the pain, where you feel the pain. You are the one wearing the shoes, and you know where it pinches you more. So please don't joke with yourself. Anything that is not normal, please go to the hospital and get treated in time, so that your baby will not die while still in the utero. Anything that you go to the hospital for in time will always end well. So some people ask me that what are the causes of this premature rupture of membranes? And I told them that it is always due to the weakening of the amniotic sac. And this is also due to intrauterine infection, excessive stretching of the uterus, just like I explained before, in multiple pregnancies, and in polyhydramnios, trauma, or an incompetent cervix. Yes, that incompetent cervix is very important, because if a woman has incompetent cervix, she will always experience what we call habitual abortion or premature delivery. And that's why it's good to always go to the hospital, to go for your antenatal clinic regularly. Because when you go to antenatal clinic, in fact, your first visit in the antenatal clinic, the question we midwife ask, some women will say, what is your own business? We will ask, how many children have you had? How many abortion? Do you smoke? Do you drink? We ask, because even smoking can cause this premature rupture of membranes. So we ask you so many questions. So if the doctor discover that you've been having this same issue and it's due to incompetent cervix, where the cervix, a woman that is pregnant, the cervix is supposed to be closed, it's not to open. So that's why you see a woman that they said that they've already told her before, or maybe she's diagnosed to have cervical incompetence. We always have abortion or premature delivery. So what doctors used to do is that as soon as that pregnancy is 16 weeks, they will ask her to come, and they will do what we call cervical encyclage. They will put a stitch around her external house, so that even when the time that baby she used to have abortion, it will not happen, because it has been closed. But they will tell her that she should not wait until she start labor before coming to hospital. Maybe the due date they give you have to come a few days before, or when you start noticing a slight pain, don't wait. The contraction is very strong, because that cervical encyclage, if you don't go to hospital in time, could lead also to complications. So you have to go back for it to be removed, for you to have your baby vaginally. So cervical incompetence can also be one of the causes of this premature rupture of membrane. And other risk factors include a history of PROM. Maybe you have had it before in one of your pregnancies. You've had rupture of membrane before, and now it can also happen again during another pregnancy. Just like I said, nutrition, smoking can also be one of the risk factors, and certain nutritional deficiency and connective tissue disorders in many cases, the specific cause of PROM remains unknown. And I said it sometime, or most time that I come online like this, that most of these cases, either medical case, whatever it is, even cancer, when you go and read any textbook or you go and check online, the first thing they will tell you is that causes unknown. but there are predisposing factors. So most cases is always like that. Predisposing factor, what can probably cause that? That's what they will now explain. So those are the things that could be responsible for that, but we are not actually saying it should be the cause. Most time the cause of these things just happen that even doctors cannot say this is what caused these things, but there are risk factors that could make this thing happen to you. So even at that, when they say smoking, please go, don't smoke when you are pregnant, don't drink when you are pregnant. If you have your baby, if you like, even the people that are selling cigarette, they wrote it on it that smokers are liable to die young. So why will I go and take something that I know that is not of benefit to me? I'm not judging anybody, but you know, all these things are habit and it's not easy to get over it. So I think those are the things that I have to say. But then there are some maternal health conditions that can also cause premature rupture of membranes, such as placenta apratus, certain congenital disorders affecting connective tissue, you know. Low BMI are associated with premature rupture of membranes. I think I'm going to stop here. So many things, uterine anomalies, unknown causes, so many things. I don't want this video to be too long. Thank you for coming. I've been talking about premature rupture of membrane. I am the Fashionable Midwife. You can check uh my page. You can follow me. You can subscribe to my channel, and I'll subscribe to yours too. Thank you, and I really appreciate you guys. See you next time. Please watch, like, and comment. God bless you. Bye.